Oh, geez, I almost elbowed you in the head. That would be good.
That wants to stand up with us. We're not going to bite, we promise. Senator Haskell just arrived, so we can start. So really great to see a good group of bipartisan legislators here today. We are all concerned about the crisis of the drug epidemic in our state. We have come together to focus on a comprehensive approach that not only focuses on treatment, not only focuses on prevention and recovery efforts, not only focuses on law enforcement, but really takes a step forward where we do this in a comprehensive way, where we're including all of those things. You guys know the story. It's happening in Maine, it's happening in our region, it's happening in our country. For Maine, the first 6 months of this year, 105 overdose deaths. It's unacceptable. It needs a strong response from policy leaders, and today we're here to announce a comprehensive approach that I think is a first step and a beginning towards addressing this public health crisis. In a recognition of this crisis, the Legislative Council several weeks ago supported 5 bills focused on law enforcement, treatment, and prevention. That was a signal to the public and hopefully other legislators that we are serious about putting our full attention and weight of the legislature behind solving this crisis. But we know that those bills aren't enough. What we're proposing today isn't enough, but it is a start and one that addresses this problem in a comprehensive way. So not only are we going to do more on the law enforcement side and fund 10 new MDA agents, we are also going to take a step towards making sure that we are making the connections between law enforcement, treatment, recovery efforts, and most importantly, I think, those educational efforts that happen at the very beginning so that people don't get hooked on drugs. We need to be in our schools talking to our students about the impact of drug abuse. Right now in Falmouth, that's happening today, where people that are in recovery are talking to students and talking to their peers about the dangers of drug addiction. So on the treatment side, the proposal, the 5 things are going to happen. One, we're going to establish more programs like the HOPE operation in Scarborough. And Chief Moulton and Officer Gill are here today from the Scarborough Police Department. Many of you know their story. In their first 50 days, they helped over 50 people that have come through their doors looking for help. They have said that there is no wrong door, and their door is one of the right doors. You're going to hear that story today. We as policymakers are going to shine a light on that example and make sure that we're establishing at least 5 new HOPE project programs around the state. What we know and what we've learned and heard from law enforcement and healthcare professionals is there's just not enough treatment options available. Whether that's detox units, inpatient, outpatient, or recovery centers, there's just not enough in Maine. We are sending our residents out of state to get these services. So one of the things that we're going to be able to do in this proposal is establish a new detox unit in Bangor. There's no detox services in the Bangor region. This would be an 8-bed facility that would provide a safe place for people to go as they begin to experience a new and better and brighter future that is free of drugs. The second thing we're going to be able to do is put more money towards inpatient and outpatient treatment. Just because you don't have health insurance doesn't mean you shouldn't be able to get the treatment that you need. So grant dollars that are for the uninsured will go towards inpatient and outpatient services. We're going to more than double the number of recovery centers in our state. Right now, there's Portland and there's Bangor. They're pretty well established. There are others that are popping up. We want to make sure that we're supporting not just our urban centers, but our rural parts of our state in this effort, and establishing these recovery centers is going to be a critical role in making sure that we're addressing this in a comprehensive way. What's going to tie it all together and be the glue to these efforts, whether it's the educational efforts in the schools, whether it's law enforcement establishing these new HOPE operation programs, treatment, recovery, we need a statewide coordinator to help facilitate all this activity. As you'll hear from Officer Gill, it's overwhelming. They have more people walking through their doors looking for help than I think any of us probably imagine. So the statewide coordinator is going to help facilitate those connections between law enforcement and treatment providers so that those that are looking for help and wanting help can get it. And I'll just end with this. We are very committed to making sure that this is successful through the legislature. I know that this plan might be satisfactory to some because it's a comprehensive approach. It will not be to others because it doesn't go far enough. But what we wanted to do was focus on what was practical and what was possible and what is a good first step. We have agreed that this issue is too important to allow politics to get in the way, that we can't allow personality conflicts to deter us, and that's why you'll see on the first day of the legislature, we'll be working hard and as quickly as we can to make sure that this package, this comprehensive plan, will be successful through the legislature. It focuses on law enforcement, treatment, prevention, education, recovery services, those things that we have heard. We've heard them from Democrats, we've heard them from Republicans. One of the most moving things that I've seen over the last several weeks was Chris Christie and his emotional and passionate plea to care about every life. This cuts across political divide. This is not something that is Republican or Democrat. This is a public health crisis that captures all of our attention. We need to make sure that we're doing everything we can to address that. I've worked with President Thibodeau and other legislative leaders to come to this place, and now I'd like to have President Thibodeau come to the rostrum.
And good afternoon. I think it's a great day for the state of Maine. As you're all aware of, on November 20th, there was an important meeting with key people from the administration, law enforcement, and legislative leaders in the governor's cabinet room. The administration made a real and compelling case for the need of additional MDEA agents. That day I made a commitment to the Commissioner of Public Safety to find and marshal the resources necessary to fund these agents. This agreement is a very important step towards fulfilling that commitment that I made. The agreement will go a long ways towards cutting the supply side of this drug crisis by providing funding for the 10 additional drug agents that the administration has requested. The agreement is also a down payment on reducing the demand side of this drug crisis, allocating equal proportions of resources to law enforcement and to treatment. It proposes to fund additional detox beds for the folks seeking recovery and treatment. It proposes to expand the whole projects across Maine, creating a partnership with law enforcement and addicts seeking treatment. These programs are much like the program that Chief Moulton is going to tell us about in just a few moments. It expands the number of peer support recovery centers. They're much like the AA model that we're all familiar with. There are several other bills that the legislature will take up in this next session. They are likely to generate long and protracted discussions about how to best use our very limited resources in combating the demand side of this drug crisis. This proposal is just a starting point for the conversations that will be held by the committees of jurisdiction. The bill will have a full public hearing, allowing all the legislators, members of the public, and the administration to weigh in, to tell us what we've done right and to tell us what we've done wrong in the bill. My hope is that the bill will be expedited with a goal of passage as soon as possible upon our return in January. In a letter on November 20th to legislative leaders, Governor LePage said he needed to know if the leaders were serious about the funding the needed agents. Out of the gate in January of 2016, the answer is clearly yes. And I believe that it's important to convey this to the governor so as to avoid the December 10th boiling point deadline. I believe it's important to recognize the seriousness of this crisis and to work collaboratively with all willing parties to address this crisis. This proposal recognizes that law enforcement alone cannot solve this crisis. Instead, a collaborative approach is needed, an approach that has been supported by the governor, as well as our United States Senator, Susan Collins, and many others. Thank you.
Now we'd like to introduce Officer John Gill. He's really led the charge in Scarborough. As Chief of Police, Chief of Police Moulton is here as well. Thank you for your commitment and support to that. And Officer Gill, if you could tell us a little bit about your experience in Scarborough.
Good afternoon. My name is John Gill. I'm a Scarborough police officer. I'm joined today by Chief of Police Robbie Moulton and Steve Cotreau, the manager of the Portland Recovery Community Center. Last year, Maine's heroin epidemic killed 100 of our fellow citizens. Projections this year exceed that number. Still, thousands of other Mainers suffer from untreated substance use disorders. For that reason, we are pleased to join with the Senate President and the Speaker as they launch their plan to help fight Maine's drug crisis. On a daily basis, Maine's police officers see firsthand the impact of substance use on families and communities. Good people, in many cases your friends and neighbors, who suffer secretly, having lost hope and seeing no way out as they fight for their life or the life of a loved one. Beyond the families of those who directly suffer from addiction, heroin and opiate misuse also serves as a major source of crime in our communities. 80 to 85% of the thefts, burglaries, robberies, and other property crimes we see are committed by people struggling with drug dependency. In addition, people suffering from untreated addiction represent a significant financial cost to our public safety, social service, correctional, and medical care systems. Earlier this year, we at the Scarborough Police Department decided we couldn't stand idly by any longer while Mainers unnecessarily suffered and died from addiction. Under the leadership of Chief Moulton and working in partnership with the Portland Recovery Community Center and the Police Assisted Addiction Recovery Initiative, we launched the heroin opiate prevention effort, Operation Hope. As part of Operation Hope, our officers receive special training to work with people suffering addiction. These are our fellow Mainers, residents of the communities that we are charged with protecting. We treat them with respect, kindness, and compassion. If someone comes to us seeking help for heroin or opiate dependency, they can turn over any drugs or paraphernalia they have without fear of arrest. Someone coming forward to ask for assistance with addiction deserves help, not handcuffs. We work with them to find treatment and recovery options. We help them get back on their feet, and we help families heal. Increasingly, however, we have fewer services we can direct them to. There are only a handful of detox beds in Maine and few long-term treatment beds since Mercy Recovery closed this past summer. I'm proud to say that since October 1st, Operation Hope has placed 75 people in long-term treatment programs they otherwise would not have had access to. Most of those people had previously sought treatment but were unable to get it here in Maine. 2/3 of them lacked the insurance or medical care coverage which would have enabled them to get treatment on their own. The vast majority of them are receiving treatment through donated rehabilitation and treatment programs in 7 different states. Despite this fact, scores of Mainers still need help. The success of Operation Hope demonstrates the willingness of people to ask for and accept help, and that recovery is possible. We need more resources to get them that help. Make no mistake, those people who commit crimes will still be arrested and charged. We remain as committed as ever to fight drug traffickers and drug dealers in our communities. But we can't arrest our way out of this problem. The Speaker and Senate President's plan will strengthen Operation Hope and help create more programs like it across the state. Their plan will increase access to treatment so we have somewhere to send people to get help. It will also fund additional Maine drug enforcement agents to support law enforcement efforts statewide. Like most cops, I became a police officer so I could help people. Maine's police officers work diligently to try to keep drugs out of our state, catch drug dealers, educate our young people on the dangers of drugs, and help people by connecting them to vital treatment and services they need. This plan will give law enforcement more of the tools we need on the front lines and is a good first step towards making our communities healthier and safer. Thank you.
Thank you, Officer Gill. Powerful story, and I think a great story and shared experience of what is possible when we do open our doors and really understand and believe in recovery and that there are second chances. Today, we're very fortunate to have with us Julie Lawson. She has been in recovery for 3 years successfully. She not only is a success story because of that, but also because she is a mother to a 4-year-old boy. She works full-time and is in school full-time. So Julie, thank you for being here with us today. If you could come up and share your story, that would be great. Thank you.
Hi, I'm Julie, and I'm going to share my experience of treatment centers and why it's crucial that we get more into this state. I was one of the lucky ones to get treatment from Mercy right before it shut its doors. I have been in and out of treatment for years before that, but Mercy, they're paraprofessionals, they're just peer support, and to be in a community, in a hospital community that there are people like you, they really pushed what recovery is. It's not just not picking up for the rest of your life. People with substance use disorder, they need to learn how to live their whole life over again. I can't express enough how substances take over our lives. It's not that we're bad people. We're just controlled by a substance and we make bad decisions. I went to Mercy's IOP, which is intensive outpatient program, for several weeks. Then I graduated to their PHP, which is their partial hospitalization program. And that gave me coping tools and a basic foundation and resources out in the community, like the Portland Recovery Community Center, where I could make connections with people just like me that have second chances, because recovery is possible. I had my family back. My son has a mother, and I'm giving it back, going in school. I'll be done with my bachelor's in 2 years in mental health with a concentration on rehabilitation, because this community is in dire need of others that will put their neck out there, because everybody deserves a second chance. And without treatment programs, you can go to detox, you can get somebody clean from the substances, but if you don't teach them how to live again and you throw them right back out to where they came in from, not all will make it. A good portion is. I'm also a part of Young People in Recovery. I'm an angel at Operation Hope. And there needs to be more families like mine. There needs to be more hope. It is possible, but we need detoxes, just not detoxes. We need long-term treatment facilities, sober houses. Right now, as I was driving up here, I got a text from the Scarborough Police Department because somebody walked through the doors looking for help. It's every day my phone goes off. More people want second chances. We're sending them out of state. We need to bring it in state so they can be with their families and their loved ones. It is possible to get help in the place where you used in the first place. And I just hope that my story of success and continuing in long-term recovery, I'm never going to be free from substance use disorder. I work on it every day. And that's something they tell you from the get-go, that it's not easy. If it was easy, then we wouldn't be here. Politics aside, these are lives we're talking about. We're not junkies, we're not drug addicts, we're people with substance use disorder, and I just really hope everybody can come together and agree to bring more places in, because my family would have lost me, my son would have lost me if I didn't have a second chance and there weren't treatment centers. And thank you all for being here.
Thank you, Julie, for being brave enough to be here and share that story. It is one that needs to be told and heard, and as you had mentioned, the group that you're working with is also at the Falmouth High School right now, talking to students about the dangers of drug addiction and to never touch it. So thank you for providing your example here today. It is a comprehensive approach. It's one that we're focused on doing everything we can on the law enforcement side, on the treatment side, recovery, and educating our kids. So very proud to have worked with a number of different lawmakers, including President Thibodeau, on making sure that we could do what we could, take this first step towards a comprehensive approach with a commitment to make sure that we don't take our eye off the ball throughout this session, throughout the year, until we start to bend the curve on this crisis. Now we'll open it up to questions.
Mr. President?
Yes?
Just before this press conference started, the governor's office released a statement saying he's using his executive authority, transferring money from a gambling control board and the DEA surplus to hire the 10 agents immediately. Do you support that?
I, to be honest with you, Mel, I wasn't aware of that, but, you know, obviously, if it's within his authority to get these agents out on the streets as quickly as possible, that's a good thing. So I assume that he's taking us at our word, that we're going to fund the positions, and if he has that authority, then let's get him out on the street.
Mr. Speaker?
I would support, again, that's one prong of our approach here, and if the governor can act on that before we get into the session, he should, just like he should if he feels like the National Guard is a solution, he should do that. If he feels like it's in his authority to fund these, he should do that, and maybe he should have done it a little while ago, but I think we're here today to acknowledge that we need a comprehensive approach. If he has a funding source, that's great. It sounds like we're halfway there, and when the legislature gets in, we'll go at this full speed for the first day.
Will you have to wait for the budget to be finalized before the money is available, or wouldn't it start until July 1st? Is that the plan?
So my hope would be that it would happen long before July 1st. This is a standalone bill. It will go to the committee of jurisdiction and then back to the appropriations committee. They can take action on that, find the funding source, take action on it, and we can get it to his desk sometime in early January is my hope. And hopefully we can get it signed and enacted so that you know, the funding's there.
Do we have any idea at this point where the funding might come from for all these initiatives?
So we have not agreed on the funding source, but we know that there are a number of funding sources available. And this is something where it's just under $5 million. I believe everybody in the legislature is going to make this a priority. They've heard from their constituents and their communities, and I believe that that's the lowest hurdle that we have. First, it's an agreement on the fact that we need a comprehensive approach, and the funding will be there. And again, a first step. We need to do more. We need to make sure that we remember what Chris Christie said, and that every life matters. And we need to use the opportunity that we have in this legislative session to do that.
We had some treatment centers closed because the reimbursements had been cut. That's really not part of this plan. I guess it's not under your discretion. It's not the Health and Human Services. So you're going to encourage maybe raising the reimbursements? Or?
That is one of the bills that we let through the Legislative Council, one of the 5 that we agreed that this was certainly an emergency and worthwhile issue going into the session. So that will be part of the conversation. That's part of the longer-term strategy. We have seen treatment centers close around the state. Mercy program is being one of them. We really need to understand all the moving parts. That is certainly one of them. And we have a bill, I believe it's Senator Woodson has brought forward a bill to address that.
And I think that the reality is we try to keep this proposal as non-controversial as possible so that we can move it as quickly as possible. And I think that both sides recognize the importance of getting the agents out, but also that you know, there has to be a good faith effort to at least acknowledge that this is more than just simply a law enforcement issue.
The money for the uninsured, how will that be allocated, and what's the upshot? How many people do you think that can help?
So for the treatment part, hundreds of lives. So for the detox center alone in Bangor, 8-bed center, that's an undetermined number because it's a rolling number. The other money for the uninsured, both for outpatient and inpatient, we're thinking about roughly about 100 people currently that could get access that currently aren't. So that's every person that's walking through the Scarborough doors and more. And the way that that's going to be facilitated, I think that's why we wanted to agree on a framework, hammer out a framework, and give it to the policy committees to identify what would be the most efficient way to get those dollars to those healthcare practitioners so that they can see those people that don't have insurance. And again, just because you don't have insurance doesn't mean you shouldn't have access.
Would the detox center be state run?
It would be, so there's a working group in Bangor that has been focused on this, and they have a real commitment to making sure that they do everything that they can. So there are healthcare providers and professionals that have been part of that conversation. So this would be state funding that would support the operating costs of those local partners.
Time for one more question, guys. Just one more.
We'll ask more questions if we need to. But first of all, are there going to be emergency meetings of the legislative committees? I mean, there was some discussion of that, but I haven't heard either one of you mention that.
So I think the agreement right now, Mal, is the idea is we'll have the committee come in actually before the legislature comes in. I believe we come in on Wednesday. That's right. And the idea would be to actually have the public hearing on this on the Tuesday before that, so that before we even get here, there's been an opportunity for the public to weigh in, and the committees can go to work immediately and do their work. So we can get it up on the floor as quickly as possible.
There's 3 representatives from the 4 leadership teams here. You guys care to comment on Representative Fredette's absence and what that may or may not say about this, the likelihood of this proposal to sail through?
Sure, we certainly hope that we will have Representative Fredette's support in this. It was important to meet and to hammer out some framework. On Monday, we were able to meet and do that. The details need to be worked out. We feel strongly that the policy committees are the appropriate place for that to happen. There was an agreement about the framework, about an equivalent dollar amount for enforcement and treatment. So, again, I hope people don't look for the conflict in this. I really think that this is too important to allow, whether it's a media story or personalities to get in the way. We're going to get there. I think everybody recognizes the seriousness of this, and I hope that through the process, everybody has an opportunity to weigh in, to give their feedback, and feel like they help shape this bill moving forward. So I think at the end of the day, my hope is that politics aside, we'll have support of every single caucus. Great. Well, thank you guys for showing up.